Welcome, 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 everyone, to another episode of Excuse Me, Doctor. I'm Dr. Melissa Clarke. Please call me Dr. Mel. I am delighted to be back here with you this week. We're back here doing what we do every week, right here on Excuse Me, Doctor, making sure that you have the information that you need to make wise health decisions for yourself, for your family, and even for your whole community. We're streaming right here on YouTube, Facebook, taking questions live. So please make sure you put them in the chat because it's going to be first come, first answered. And if you're newbies to the show, I would love if you would hit subscribe on YouTube and like on Facebook. Really appreciate you for doing that. So let us now get into creating an amazing week for ourselves with all the stuff and health topics that we're going to talk about today. I want to welcome my co-producer, Mr. Wayne Bruce, who brings us the word from the street, lets us know what's on everybody's mind out there in internet land, and is the voice in the studio for you. So
hold on,
welcome,
Dr.
welcome,
Mill.
welcome.
We got a little shot going out here. You know what
All
I'm
right.
saying?
You all are getting a sneak preview of
That's a
our
sneak preview.
fantastic, right, of our
That's what
fantastic
happens.
guest, Dr.
That's
Corbin.
what happens at the last one. Hey y'all. Hey, I'm here. Everything's cool. Nobody
Yeah, I
knows
know.
anything.
Right, for you all who watch on a regular basis, I know y'all said, "Wait a minute, that doesn't look like Lila." So Lila's not joining us this week, but she will be back very, very soon for all you Lila fans out there.
Lila is important. You know what I'm saying?
Yes.
She got important
Right.
things to do.
Right.
Anybody watch
But
the
she'll be
Grammys
back.
last night? You would have seen Lila.
Right. Right.
Right. How you doing, Dr. Mel? I'm looking
Doing
forward to this
great.
show.
I
You know, it's
know this
award
is going to be
season.
incredible.
It's
Right.
award season. And last night, well, we don't want to date the show, but some things happened last night at one award ceremony that reflected upon another award ceremony.
Right. But the other award ceremony we know had that quote unquote slapgate, right?
What?
That people have called it. Yeah.
Slapgate.
And people have analyzed it, reanalyzed it, overanalyzed it. But under all that hype and, people trying to assign blame about who was at fault, I want to see, is there a health lesson to be learned about trauma, about triggers, and about violence? Is there any relationship between that slap and the high rates of young Black men dying in altercations about respect? So we're going to unpack all of that. I know I put a lot out there. I know everybody probably has an opinion. Don't hesitate to put it in the chat. But we have some experts, y'all, who we are going to talk to about this. They're experts in trauma. They're experts in preventing violence. And so we're going to have a fantastic show. So share it with everybody you know, because we're going to have a great discussion.
Share it, as they would say.
Yep. So should we jump into our recap? Talk about like the health highlights of the week?
We should jump into our recap because that's the next thing to do. Here we go.
All right.
So Dr. Mel.
Yes.
We got to start with the numbers, right?
We do. And so this is a thing. I'm not even going to talk about the number of cases because we have some good news. We're actually at an all-time low with cases, new hospitalizations, and deaths. Cases, though, keep it in mind that they're being undercounted because a lot of people are doing testing at home, or they might not even be having any symptoms at all. About 600 people, 584 people to be exact, died from COVID yesterday, which brings us to about 979,000 deaths from COVID in the United States thus far. With vaccinations, we're kind of stuck right where we were last week. We're not really seeing a lot of new people getting vaccinated or new people getting boosted. But this is a deal, y'all. Even with all this good news in terms of the number of cases and hospitalizations and deaths dropping, cases are surging in the United Kingdom and so are hospitalizations. The other thing is we're detecting more COVID-19 in our wastewater. And both of these are sort of foreshadowing what might happen in 2 to 3 weeks with hospitalizations in this country. And then kind of contrast that with the fact that reporting of cases has gone down, like I said, because more people are
Yeah.
home testing.
Mm-hmm.
Then you got this BA2 variant that's nicknamed Stealth. Did you know that it was called Stealth, Wayne?
No, why is it called stealth?
Because it's harder to detect in testing and it's more contagious.
Ow.
And so even as we're busy dropping our vaccine mandates and mask requirements to assemble in public and in indoor spaces, we're also finding out that long COVID is more common and worse than we thought. So with
Yes.
all these things, I say this: stay on guard. If you or those you interact with have chronic health conditions, you're unboosted, or heaven help us, you're unvaccinated at this point, keep your mask on, still wash your hands, do activities outside whenever possible, roll the car windows down, and get vaccinated and boosted. Please, I implore you. And then there's this new the fourth dose or the second booster
Right.
that the FDA approved for people over 50. It might be time for folks over 50 to go ahead and get that second booster.
And stop calling my phone asking me should I ask Dr. Mel should they get the fourth booster, the
I didn't
fourth
even know
shot.
you were getting those questions. Are
I'm
people
getting
are
those
people
questions. I'm getting
hitting you
those
up with that?
questions all around, Dr. Mel. I am. I'm
Okay.
sorry.
Well,
People
we
know
should
I know
answer that
you.
tonight.
People
Yeah.
know
Well,
I know you.
we should answer that tonight and say yes. Go ahead and get that second booster. If definitely if you are if you have problems with your immune system, you're immunocompromised,
Right.
and now if you're over 50.
Right. Exactly. Exactly. We heard that. So
Yeah.
get
Oh, somebody else texting you.
I man, somebody else is just asking me, should they get the fourth shot?
Wow.
Mm-mm-mm. So yeah. So look, what about and so our vaccine rates are up, right?
Um, y- just slightly, just slightly.
Okay.
But I think the next thing to talk about is not getting long COVID.
You do not want to get COVID. Let me just read that verbatim. You do not want to get COVID.
No.
Uh, talk about it, Dr. Bill.
Well, I would say blessings to those people who've had COVID and are right as we speak enduring long COVID.
Mm-hmm.
We know that that could be, at least 5% to 20%. The estimates range in terms of the number of people that go on to get long COVID afterwards.
Right.
But if you haven't had COVID, or even if you've had it and not gotten long COVID, you don't want to get COVID and you don't want to get COVID again. Because in addition to kidney disease, heart attack, and stroke, people who get COVID-19 also have a greater risk of developing diabetes up to a year later compared to those people who never had COVID. So the worse the case of COVID that you had, the higher
Yeah.
your risk is, right?
Right.
And then if you were hospitalized, you had roughly triple the rate of risk of diabetes getting it later compared to people who never had COVID.
Mm-hmm.
And if you already had a risk factor like being overweight or obese and you got COVID, you develop diabetes at twice the rate of those people who never had COVID. So even people with mild infections, though, and no previous risk factors had increased odds of developing diabetes in this study. And so, it really is concerning because what this pandemic may leave us with is just a lot of new chronic disease in people who otherwise wouldn't have gotten it.
Wow. That's sad. That's very
Yeah.
sad.
So
And
getting vaccinated, another reason to get vaccinated and boosted because it cuts
yeah,
that risk. Yeah.
for all you late arrivals to the show, look, you're not late, but she said this. You don't want to get the new variant. You want to get the vaccine, the booster, and you do not want to get COVID. All right.
Right.
Everybody showing up late. But now we get to turn up with some avocados. Every year at the Super Bowl, the avocado commercial is my favorite one.
Right. Mexico. What is it? Avocados from Mexico.
Right.
Right. Well, they need to put this in the commercial because there was a study of over 100,000 people. They followed them for more than 30 years, and they showed that those people that ate 2 servings of avocado a week, which roughly is the equivalent of one avocado, a whole avocado, or a cup of avocado, if they do that a week, it reduces the risk of developing heart attacks and strokes.
Mm-hmm.
On top of that, if you substitute out just a half a serving of butter, cheese, bacon, or other animal products with an equivalent amount of avocado, you cut your risk an additional 20%. So,
Wow.
yeah, go for the avocados, get the guac, put it on your toast, put it in your salads, eat up.
Turn up on your avocado mix.
Turn
So,
up on the avocados and the guac.
so this is
Absolutely.
relevant because we have a lot of friends. I have a lot of friends who have teenage children, and some have asthma. And throughout this pandemic, they've been going to the hospital more.
Yeah.
What's
Yeah. So we're seeing that teens are getting sicker, but this is specifically about prediabetes. So diabetes seems to be the theme of the night here. We're seeing that prediabetes has more than doubled in the last 2 decades among American teens, and that's age 12 to 19. The increase was actually more in boys or young men, rising from about 16% to 36%, so more than doubling. And in women, it rose from 7% to 19.6%, also more than doubling. So it's really a call if you're a parent or you're a teen to really focus on healthier eating, less sugary and processed foods, more movement. So children and young adults really should be getting on average an hour of moderate to vigorous exercise most days of the week, right? So substitute the video gaming uh, for playing basketball or doing something outside that involves movement and activity for at least an hour a day. And then also focusing on the tremendous amount of stress that we've all been under, and young adults and teens also are under that tremendous amount of stress, and it's affecting their sleep patterns. We know that there are all these extracurricular activities, so kids are staying up late to do homework and then getting up early in the morning to go to school, and they really need at that age at least 9 hours of sleep a night. So that's also something to keep in mind, because lack of sleep, and we talked about this just last week, lack of sleep leads to increased caloric intake, which then sets you up for the prediabetes.
Sets you up for prediabetes, and that means a lot of trouble coming down the pike.
Right, exactly.
So what people are getting set up for, though, is getting the medical okey doke, especially our folk.
This is true. Well, it's for women and also people of color. So, of course, that means women of color. That it happens far too often that our symptoms are inappropriately dismissed or considered mainly in our head, or our weight or lack of self care are blamed as being the cause of a symptom or symptoms that we show up to when we talk to the doctor. This actually even happened to me. It's one of the reasons I wrote my book. I had a ruptured muscle in my neck after an accident. It was bleeding. I had some internal bleeding. It was very slow bleeding. So over the course of 3 days, it got worse and worse and worse. I went to the emergency department, and they basically, I told them I couldn't breathe when I lay flat. They told me, here, take this anti-anxiety medicine and go home.
Ooh.
And it didn't get better. I went back, and thank God I was diagnosed and had to have emergency surgery. But that happened to me as a physician, right? So it turns out that women are more likely to be misdiagnosed than men in a variety of situations. Women wait longer to be diagnosed with cancer and heart disease, and often are treated less aggressively. People of color get referred to specialists less often, less likely to get standard of care if it's more expensive, like heart catheterizations or cancer treatments. We talked about that last week with multiple myeloma. And so And then finally, doctors are more likely to describe Black patients as uncooperative or non-compliant, which research suggests can affect treatment quality and are more likely to spend the majority of the visit. So the doctors spend more of the time talking to Black patients than they do to white patients. They listen more to white patients than Black patients. So what can we do? I have 3 suggestions, but keep in mind the book Excuse Me Doctor, I've got what has a whole chapter about this. So, number 1, bring a relative or friend with you to your medical appointments. It helps to have an advocate to say things like, she's not a complainer, or he's not usually in this much pain.
Right.
Second thing, never leave the office without asking the doctor this question: Doctor, what are the top 3 things this could be? And what is your plan to either rule it in or rule it out? And the plan entails testing, treatment, or referral, right?
Mm-hmm.
And then the third thing is, don't hesitate to get a second opinion if you feel uncomfortable with what you've heard or the way you've been treated, especially from a physician of a similar, getting a second opinion from a physician of a similar cultural background. You know your body best, and if you're experiencing something that seems off, never assume that it's quote unquote all in your head.
Absolutely. Absolutely. I think those
And
are incredible rules. And they actually saved, I remember that from the book. And it saved my dad the first time he got sick. So I want to thank you for writing the book. And I want to shout out Yvonne, who says, "Excuse me, doctor," should be right next to your Bible and Dr. Spock's baby book. So
well, thank you, Yvonne.
go to www.drmelissaclarke.com, order your book
Yeah, yeah.
right there. Excuse me, doctor. Okay, we're back from the messages. You know what time?
What time is it, Wayne?
Do you know what time? Do you know what time
It is.
The weekly debunk.
the weekly debunk.
Stopping misinformation in its tracks.
So I got
Highly
this text from Teddy Twitter Fingers. He's the cousin of Tyrone and
Okay.
Tanika and Tanisha Twitter Fingers. He said
Okay.
he's a conspiracy theorist. He says y'all caught up on this vaccine and COVID, and y'all are just pawns of Bill Gates. You know, a group funded by Bill Gates, patented the COVID-19 virus. He owns it, and he misspelled this word, and is controlling all of this mess. I ain't no pawn, and I ain't taking the vaccine. So I had to hit him back like this. I said, I don't know about that. Excuse me, Dr. Mel, is that true?
Well, I've heard this concern, and we've even been called pawns of Bill Gates on this show because we advocate vaccination. So there's a partial truth in this. A coronavirus, not the coronavirus, was patented. Now, what do I mean by that? Coronavirus is a family of virus with many cousins in the mix, just like the Twitter finger family. They have many cousins in the mix. So there are a lot of, Clarks, there are a lot of Twitter fingers, and they all have similar DNA, but each cousin acts and looks differently. So it's the same with the viruses. Our current enemy, SARS-CoV-2, is different than another SARS virus, which was SARS-CoV-1 20 years ago. And then there's also the one that produces the Middle Eastern Respiratory Syndrome, or MERS. There are also about up to 30% of coronaviruses that just cause the common cold. So there are a bunch of them out there. So when you hear about a patent on the coronavirus, the first question should be, which one? So the answer was this. There was a research institute in England, the UK Peerbright Institute, that filed for a patent in 2015, so way before this pandemic started, on research related to the bird coronavirus, or the avian coronavirus. That is not SARS-CoV-2. They had done some work on substituting out some of the DNA in the virus in order to develop a vaccine, and they wanted to patent their work that they did towards that work, towards that end. And they did receive funding from the Gates Foundation, which funds research worldwide on vaccines, on malaria, on a lot of stuff. So, um, uh, it could be debated, should we be allowing patents to happen on viruses? That's a whole separate discussion. But I will say that people who advocate for vaccination are not pawns. We're just out here in these COVID streets trying to debunk um, the people that are spreading misinformation like this because it seems true on the surface because disinformation has always a little kernel of truth in it, but you got to dig a little deeper to understand why it actually is not that way. And so, I would say, you know, it was his Teddy Twitter fingers, you know, dig deeper, don't believe the hype because people who say these things don't always have our best interest at heart.
There you go. And there you have it. And there you have it.
All
That's it.
right.
That's the debunk.
Well, thank you. Thank you, Wayne. We're going to see you
I
back
did it
in
all
just
today
a
with no
little.
Lila.
I know. I know I miss her. I mean, you did great, but I miss her. We're going to see her soon. Um, so thank you so much again. And we're going to see you back very shortly. We're going to jump right on into the rest of our show, which, is really about violence as a public health crisis. Our young people and even our older people who feel like violence is a way to gain back self-respect sometimes end up disabled or even dead. Black young people disproportionately die from violence, and violence is most likely perpetrated by people who've been victims of violence themselves or witnessed violence. Um, and so with this event that happened last week on at the Oscars, there might be a lot more at stake than just two black men fighting on TV or just two men fighting on TV. Um, and I also don't want it to get lost that we're talking about trauma and violence on this 54th anniversary of the murder of Dr. Martin Luther King. So I just want to salute him. Um, and so let's dive into this episode of Excuse Me, Doctor, with this fantastic panel that I have. Starting off, we have Dr. John Rich, who is a professor of health management and policy at the Drexel University Dornsife School of Public Health in Philadelphia, where he is also the director of the Center for Nonviolence and Social Justice. His life's work has been to promote health equity, especially where trauma, violence, and adversity in our communities of color intersect. And he wrote the book Wrong Place, Wrong Time: Trauma and Violence in the Lives of Black Young Men. Welcome, Dr. Rich. I am delighted to have you here this evening.
It's my pleasure to join you again, always.
Absolutely. And then we also have Miss Michelle Blackwell. She's a go-go recording artist, an author, a project manager of the Black Coalition Against COVID, and she's the former program manager of Cure the Streets Violence Interrupter Program. Thank you so much for joining us, Ms. Blackwell. And then
thank you for having me.
Absolutely. So glad that you're here. And then last but not least, definitely not least, Dr. Theodore Corbin. He's professor and chairperson for the Department of Emergency Medicine at Rush University Medical Center in Chicago. Along with Dr. Rich, he co-founded Healing Hurt People, an emergency department-based trauma-informed intervention for victims of intentional injury. Welcome, Dr. Corbin. It is truly wonderful to see you back again.
Thank you, Dr. Clarke. It's a pleasure to be here.
And I have to say, all three of you all are friends of the show because you've been on before, but you weren't on with each other. So this is a great opportunity to have a really interesting discussion tonight. So I'm going to start off with you, Michelle. What are some of the things that you've heard this past week, sort of on the side of Will Smith in terms of the fact that he was defending his wife's honor?
Thank you for the question. So some of the things that I've heard. Can you guys hear me?
Yes.
Okay. Yeah. So some of the things that I've heard regarding Will Smith and his and what could be his intentions were that Jada Pinkett had made it publicly known that she had been suffering from alopecia and that she was struggling with insecurities because of it. And also there was, there were some videos that resurfaced from Chris Rock's former Oscar hosting when Jada had done her letter asking people to boycott the Oscars because of the lack of Black participation or Black recognition, and that he was dismissive and some might have said disrespectful toward her then. And I think the sentiment was that although he is a comedian, that Will Smith was there not as part of a roast, but as someone who was potentially going to win the very first Oscar of his career, and that he had just been, he and the family have been getting piled on for quite a long time, for years in the public, whether it be comedians or on social media, and that he just kind of snapped. No one, those that are defending don't think it was necessarily premeditated, but but sort of like a breaking point, and he just acted on impulse.
Right. And I also heard too that defending someone's against an insult, something that's very hurtful, that it's justified to, he was justified in the actions that he took. I also heard that as well. And so, Dr. Rich, when you hear that, when you hear a justification of violence in this sort of setting, what are some of the things that you think? How do you process that?
It's complicated, isn't it? Because we have two individuals, we don't really know their history, but we have a sense that maybe they have suffered challenges in the past. I believe that one of the folks in his memoir talked about trauma, but that's common. We know that across the country and the world, many people have experienced trauma as children. So we have to take into account that history. But we also live in a context of masculinity. And in masculinity, we often talk about toxic masculinity. That is boys and men growing up believing that the only emotion that's acceptable for them to have is anger. And the only reaction that's acceptable is physical violence, even if the initial insult was words. And so it's that context. We all grow up in it. We all reinforce it somehow by putting this on to men. So it wouldn't have been in that setting acceptable for someone whose feelings were hurt, a man, to simply say, my feelings were hurt. You really, that really made me sad when you did that. And in this setting, it's what's so extraordinary is that there was every opportunity for the discussion to have been one of words. So words hurt someone, and it could have been that there was a discussion. So Will Smith could have gone to the mic and he could have talked about that. And so we can hold the individuals accountable, and we ought to, but we also have to all realize that we feed into this because we put this expectation on men, and we don't recognize that many people are bringing this trauma into the situation, whether on the stage at international awards or down the street where young people might come together and these things might play out, often in the presence of firearms or other weapons.
Right. No, I think those are all excellent points. And I wanted to bring Dr. Corbin into the conversation. Your research focuses broadly on addressing trauma in the lives of victims of violence, especially boys and men of color for whom violence is a leading cause of disability and death. So, Dr. Corbin, what causes us to respond violently when we're not physically threatened, such as in this instance? And what has some of your work shown?
Yeah, I think I have to piggyback on what Dr. Rich said, in that, it is complicated. And I think what often goes unsaid is that historical generational trauma that many of us, particularly people of color, have experienced. And so the other piece of that is really how do we give our young people, our people of color, or anyone for that matter that's been exposed to violence, how do we give them tools to heal? And so that's been a large part of our work. And so you were talking about sleep. That is such a deficit in some of our young people that have experienced trauma, not being able to sleep. And so giving them tools and methods of how to do such is really important. And that's just a slither of some of the things because it's so multifaceted. But it is really arranging processes and programs and techniques for folks to work to heal from the trauma that they've experienced. And I also feel like even though it was, I have to say that it was just a terrible thing to see on stage.
Yeah.
And we have such a ripe opportunity to make it right when we talk about reconciliation, like to speak the words of "I'm sorry" on both parts. There was no
right.
there was nothing meant in terms of what I said or did, and I apologize that it did, and I apologize for putting my hands on you. And I feel like that's where we have to move forward into this reconciliation piece.
Right. Because just as the act of violence itself might have been a model for some, the reconciliation would be an even more powerful model, right? So Michelle, can you tell us about your work with Cure the Streets? And what actually happens? What is some of the work that Cure the Streets does?
Okay, thank you for that. So Cure the Streets is under the umbrella of Cure Violence Global, which is an organization that was actually started by an epidemiologist named Dr. Gary Slutkin, who was working on the Ebola virus over in West Africa for some years and came back to the States. And when he got back to Chicago, he noticed that the way that the violence in Chicago was the way that it was tracking. It mimicked how viruses are spread. So it intrigued him, and he started talking to people, to different organizations, and seeing what they were doing, what was working and what wasn't, and came up with the idea of forming Cure Violence Global. So basically, what it's about is it's about stopping. It's first and foremost, it's about approaching, trying to cure violence with a public health approach rather than a criminal justice approach, and using violence interrupters. I would say about 80% of the people who work as violence interrupters for Cure Violence Global, and Cure the Streets is the chapter, so to speak, of Cure Violence Global. Baltimore has one. They have chapters all over the world. In fact, they have some in South Africa, in Jamaica, in Kingston. I mean, they're all over the place, in Brazil, South America. And so, again, DC's version, Cure the Streets. So there's what it's called the Cure Violence model. And what it does is the aim is to get violence interrupters, who the majority of are returning citizens, who have a certain amount of street credibility, so they can get into spaces that other people cannot, to talk to young people about their journey, about the things that they have done, the mistakes that they've made, what made them change their lives, and more importantly, to find out about conflicts before it escalates to gun violence. And if there is an incident of gun violence, to stop the spread of gun violence, because again, once one act once one act has occurred, there are generally others. It spreads like a virus. Once one person is infected, then someone else gets infected, and then someone else, and that's how. So they have historical beefs that have spread violence in one neighborhood over a 2-decade span. So it's multi-layered, but the gist of it is stopping the spread of violence before it happens, and if it happens, stopping violence from happening, and if it does happen, stopping it from spreading through violence interruption, through conflict resolution.
Right. And so what I also hear you saying is that violence is spread, it's modeled, right? And it can be stopped as well, which I think goes back to one of the things that Dr. Corbin was saying in terms of the power of reconciliation. So we know that, and you mentioned young people, we know that young men aged 15 to 24 who are African American are at increased risk of suicide and homicide at a higher rate than their white counterparts. What are your thoughts on why this is? And is there a relationship to past trauma? I think, Dr. Rich, you mentioned childhood traumas, which are also called ACEs, adverse childhood events. Can you sort of speak to the role that might play in some of the statistics that we're seeing?
Certainly, we know that the cycle of violence is fed by trauma. We know, for example, that what post-traumatic stress does to the body and the mind is it makes you perceive things that ordinarily wouldn't be threatening to you. They seem life-threatening. And so if you've experienced lots of trauma in the past and you come into a circumstance where someone's maybe looking at you in a threatening way, or you perceive it as such, you may react as though your life is being threatened. And so we have to think about that in the genesis, certainly, of violence, of individuals hurting each other. But we also have to acknowledge that of the 14 or so thousand firearm homicides in the country, that there are 14,000 or so firearm homicides in the country every year. There's another, probably the total number of injuries there's another 26,000 firearm suicides. And so we know that firearms are a key critical issue that we don't talk about enough. So we have to acknowledge that the proliferation of firearms in communities is feeding this cycle. And while we are seeing increases, certainly in suicide among youth of color, that also relates to the trauma and the resulting depression, which is also a post-traumatic symptom. But with this, what is very true about this is that this firearm issue is affecting all of us, because certainly a large number of those who die by firearm suicide are young white people. And so we know that there's a disproportionate impact on people of color, but there's a dramatic impact on families and communities across the country. So we have an opportunity to heal the trauma, to acknowledge the trauma, to acknowledge the racial trauma that is its own unique type of trauma. And then all of us collectively to say we have got to deal with this firearm problem. Because what happened the other night, what was so shocking to us was really difficult, as Dr. Corbin said, it was really difficult to see, and it was very upsetting. But it didn't result in a death. It didn't result in the loss of an individual in the community. And we have an opportunity to do the restoration. With firearms, we don't ever have that chance. And so we have to speak out, despite, I think, often you can get folks who attack you for talking about doing what we need to do and limiting firearms. But I think we have to speak out boldly. Otherwise, we will not be able to make the kind of advance that we need to make against these deadly forms of violence.
Right. And then, you mentioned the not just individual trauma, but racial and cultural trauma. There's that interesting study that a lot of people may know about already that shows that in the Dutch potato famine and also the Holocaust, that survivors of those traumatic events passed on genetic changes to their offspring that put them at higher risk for experiencing things like obesity, heart disease, but also depression and PTSD. So when you think about the racial trauma that's happened in this country that's been sort of handed down over many generations, and then compound that with the adverse childhood events, it's sort of no wonder that there are a lot of people who are dealing with that sort of hyper response to things that may or may not really be a threat, right? Similar to how you describe PTSD. And so with that in mind, Dr. Corbin, can you tell us a little bit about healing hurt people and what trauma-informed care is?
Sure, I'm happy to. So healing hurt people resulted out of recognizing that there was this revolving door of young people, or people, and largely people of color, that were coming through the emergency department that were shot, stabbed, and or assaulted. And the status quo as healthcare providers is if it doesn't hit a major blood vessel, a bone, or an organ, is that we're going to patch you up and discharge you, regardless of whatever the hidden wounds might be. And so our efforts were really to address that. And there's some colleagues that are across the country that are a part of the Health Alliance for Violence Intervention that have really embraced and taken on this issue of identifying the young people that we see who have been survivors of violence and addressing their symptoms of trauma, providing case management, and also some proactive healing, and giving them some tools to help them heal. And that, in some instances, that could very well be getting them insurance so that they have the appropriate follow-up care, because we know a large proportion of young people, particularly young men of color, fall out of care and don't resurface until something's wrong. And so how do we focus on the preventive care and also the healing aspect of those things? But then also just plugging folks back into the grid, because of many, sadly, the young people that I've seen, the young people that I know that that Michelle and Dr. Rich have seen are also unplugged from any resources that they would benefit from. So the efforts are really to provide case management, behavioral health counseling, as well as connecting them to the resources that would help them heal from what they've experienced, and identifying them and destigmatizing it completely.
Right. No, that's fantastic. And Michelle, are there also some of those aspects of plugging people back in Cure the Streets as well, in terms of the interventions that are done?
Absolutely. In fact, part of the Cure the Streets model, or the Cure Violence model, is not only to stop the violence or to stop the spread of gun violence before it happens by mediation, but also by identifying what we call our high-risk individuals and having them become our clients, or what we call participants. So we have our violence interrupters who are more engaged in mediation, and we have our outreach workers that work with high-risk individuals to get them mental health services, substance abuse services, financial assistance if need be, housing assistance if need be, if they need continuing educational help. There are a myriad, and it's interesting that it was mentioned that trauma is usually preceding childhood traumatic instances, and PTSD has a lot to do with people who commit violence. Many of the high risk participants, those who have been shot before, victims of violence, or who have committed, even our employees who have, who were returning citizens, spoke about childhood trauma, whether it was child molestation, child abuse, emotional abuse, physical abuse, witnessing violence, even if they were not a part of it, from domestic violence from their parents. There are so many, and I think mental health is still such a taboo subject in the Black community. Unfortunately, and in particular with our Black men, that is one of the challenges that we've faced in getting them to agree to mental health services. But we do, they are offered, and a lot of our young people are steered in that direction when they come on board as participants.
Right. No, and I definitely hear similarities in the two programs, and I think one of the takeaways is that, you know, there are multiple layers to this onion that need to be peeled back, and that things are never what they seem on first blush, right? So I'm going to stop here and go ask Wayne to rejoin us, bring in any audience questions and comments that are hanging out there. And,
Wow.
you know,
We're in a tight
rejoin
shot
the
here.
conversation.
It's hard to
Yep.
get a big man in the shot. So the conversations is incredible and needed. We have a lot of comments, not a whole lot. Well, we have a few questions. We have a couple questions coming in from the West Coast. Angela Mays asked the doctors, are there certain chemicals released during these violent episodes?
Dr. Corbin, would you like to take that one? Sure. There are chemicals that are released. I think one that is really difficult to measure is that of cortisol. And what we know is that cortisol is really good when we need it for that fight and flight reaction, but then too much of it really does have its effect on our physiology in terms of our healing power. And so it really does have an impact. And then over the long haul, we talk about that piece of it. Constant reaction. I think you heard Dr. Rich mentioning that reaction, that overreaction to something that doesn't necessarily deserve that type of reaction. When that constantly flashes on a regular basis, it just bathes our body in that particular hormone, which can be damaging to our healing power. Right. And it's definitely associated with higher rates of chronic disease down the line, diabetes, heart disease, cancer, certain cancers, all the things that we hear about are disproportionately experienced in the Black community and other communities of color.
And if I could just add, one of the things that happens, our fight or flight response that Dr. Corbin mentioned, is that when you're confronted with something that you feel is threatening, you feel it in your body, right? Your heart starts to beat faster, your hair stands up on the back of your neck, all of those things. And if we, part of what we have to also do is recognize that in these moments, we will feel that these experiences, trauma gets under your skin. And so what we need is a community of folks who can look at you and say, listen, that thing really got to you right there. Let me be here with you until that calms down, because it's going to calm down in seconds most of the time. But if we react and act on that heightened sense of hyperactivity, that's when violence and other things happen. So we also need a community that says, listen, that's normal, but let's not hurt anybody while you're in that state. Let's see if we can, bring that in, whether we meditate or we use some music or we use some yoga, we do something, because we can heal. And we have ways in our community. We have ways to heal. We have natural healers. And the work that Michelle is doing is really highlighting those people who are natural healers in this space.
Right. And I also want to call out the fact that we have two musicians too, because music is healing.
Absolutely.
Thank you. We have another question coming from Dwayne Smitty Smith. With all the recent incidents, mass shootings, school shootings, how do we guard our mental wellness?
Wow. Excellent. Who would like to weigh in on that? That's a really important one. It's not just the violence, it's also the deprivation, the isolation, the loss of jobs, and economic security, war going on, lots of things. Anybody want to
take that question?
I mean, I'm happy to start, but I do think it is such a collective issue that I think in some instances it does require an extending of our hands across the aisle to help our brothers and sisters. And so, because in some instances, what one feels, they're not necessarily familiar with what that feeling is. So just a basic understanding of what that is so important. And we don't do that. I didn't get that in grade school or not even high school, not even college maybe. But, so I think it really is important. And we have a generation, this is where I feel a little bit hopeful, in that we have a generation that is really in touch with their feelings. And when they ask for help, it cannot be that we dismiss them and say, you'll be okay. That's not the right way. It's more of asking questions of what happened or what's going on? What are you feeling? And that's where we can work together to help others heal. It's not a one person that can do it themselves. It is a collective.
Yeah. And also knowing when to ask for help too. Like you said, I think, we know mental health has been stigmatized for a long time, but I'm hopeful because I see young people talking about mental health more. I see them being more willing to ask for and receive help, and understanding, if you're having loss of appetite or problems sleeping or thoughts of harming yourself or harming others, or just feeling, like you're not able to sleep through the night, you feel anxious on edge. All those are signs that it's time to reach out and ask for help, whether it's a friend, whether it is your minister, your counselor, a therapist, your primary care doctor. All those are possibilities and places to go to get help. There are even 1-800 numbers. SAMHSA has a 1-800 number. It's a government agency that you can call to get a referral, and I'll have to put it in the chat when the call is over because I don't have it memorized, but I will definitely do that.
Okay. We have a few statements in our chat. Valerie Spalding Parker says prevention and proactivity is the key. We do have a question from Yvonne Smith. She says, why are not women or girls becoming violent?
Well,
Okay.
Can I take that one on?
Yeah,
Yes.
please.
Why
do.
are they? I would like to take that on because that's actually, unfortunately, not true. Based on the work that I've done, and mind you, the program that I managed, the violence interrupted program that I managed in Ward 8 covered Condon Terrace, Washington Highlands, and Trenton Park over in Southeast. And I think people would be surprised to know that there is a trend, unfortunately, of young women getting more involved in violent activities, in committing violent acts. And I am, I'm not sure when the trend started, but it's been going on. I was program manager there for almost 2 years, and it was already an issue when I got there. Now, mind you, women, are not statistically being arrested for committing violent acts as much as men, but the trend has gone up with our young ladies. And I think that speaks to, just very quickly, and then I'll let the doctors, because they're the experts, speak on this. I think that speaks to just to me that there's a culture there's a what I call violence culture, this sort of acceptance now to resolve conflict with violence, whether it be a smack, a punch, a kick, or even non-physical, an insult, just our inability to sort of resolve conflict without not just violence, but just it escalating or de-escalation tools. We seem to have a lot of that has seemed to have fallen by the wayside, almost to the point where it's not just normalized, but sort of glorified, whether it's in our music and our movies, and people don't like to go there. But I just think that we also kind of need a paradigm shift in how we just treat one another in general, and how we resolve our conflict. And unfortunately, our women are being caught up in that too. And I'll let the doctors weigh in on that.
Nothing more to add.
Yeah, I think you dropped the mic on that one.
Yeah, really.
And that's exactly one of the things that I wanted to, that I think is important to underscore with all the discussion that has gone on this week was sort of as you mentioned, sort of a normalization or glorification and saying, yes, it was perfectly fine for someone to assault someone else based upon issues of respect, which is the very same paradigm that we're seeing that's leading to, as you mentioned, increasing trends towards violence in young women who normally had not been experiencing those trends before, and of course the trend that was already there among our young men. So yes, definitely well said. Do we have time for one more, Wayne?
No, we do not. We are out of
wow
time.
Well, thank you all. You all have been just absolutely fantastic. You've given us so much to think about. I mentioned Dr. Martin Luther King at the beginning, that this is the anniversary of his assassination. And I wanted to just use a phrase that he coined, the beloved community, really working towards that beloved community, as Dr. Corbin and Ms. Blackwell and Dr. Rich all said, really creating a new paradigm, a paradigm shift of being able to really approach each other with compassion and empathy as the leading sort of emotions as we look at situations, and not immediately with judgment or anger or resentment or vengeance. So thank you all so much for joining us. Thank you again to my fantastic and wonderful co-producer, Mr. Wayne Bruce. Before I go, I just want to mention one more time that we at Excuse Me Doctor are working with Howard University to help recruit individuals who want to participate in a research study that Howard University is doing on how you have coped during the COVID-19 pandemic. It's called the COVID Resilience Research Study. Participation is voluntary. It only involves filling out a 2-part survey for which you will be compensated up to $100 depending on how much of the surveys you are able to fill out. If you have any interest, please reach out to my assistant, Dana Harvey, at danaharveyresearch@gmail.com. That's Dana, D-A-N-A, Harvey, H-A-R-V-E-Y, research@gmail.com. Well, that is it for us tonight. We will see you in a week. And until I see you, please remember, be wise, be well, and be health empowered. Thanks so much for joining.